I'm Sophie Partlow. I am the mother of Magnolia Day Partlow, who was born at 23 weeks and 5 days, which is extremely early because it's only about halfway done marinating in the oven. So she's what they call a super preemie. So she's born very early and is now 6.5 months and giving you some smiles. What is so strangely fortuitous is that we have a 5-year-old who we adopted at just 2 days old, and she was born at 32 weeks. We've kind of had the premature experience with her being in the NICU for over 2 months and dealing with, I guess, just all the trappings of that. So it was unusual that when I was pregnant biologically for the first time, it honestly didn't really enter my mind despite having had that experience. So I was actually more focused on not being induced early and what would I do if my pregnancy went over 40 weeks, as opposed to what could happen if she was actually born early. So it was a huge surprise that she came as early as she did. I did not recognize the signs of preterm labor. I had no idea. I genuinely was cooking dinner and thought, oh, wow, this must be some round ligament pain, or maybe this is the Braxton Hicks everyone talks about. But it was just so painful. I was like, this isn't good. This isn't really normal. So I talked to my husband and he was like, you should just call and see what's going on. And I told them what was happening. They were like, yeah, just come on in to get checked out. It's probably nothing. So I go and the pains just continue. What I was feeling were actually contractions. And so when you hear contraction and when you read up on, what a contraction is, you imagine it being this sort of contracting, this feeling of pressure, but that is not at all what I experienced. It was just pain. Every minute or two bursts and lasts for about 20 to 30 seconds. The intervals became less and the pain became even more. And it was only at the point that they actually did a cervical check and saw that I was almost fully dilated, that her membranes were showing, that they were like, okay, this is this is serious. You're staying here. They did try to stop the contractions. They gave me some pills like every 15 minutes to try and stop the contractions, but it just didn't work. So she was ready to come on out. And so here she is. It was, of course, very scary. But I also felt a bit of a resignation. I was almost like, okay, I'm going to lose my baby. This would be my second loss. I had a miscarriage at 7 weeks. I have to be forward thinking, just like last time, like I know it's going to be hard, but we'll move past it. So I was already trying to get myself in a mindset of, what's next? Try not to linger on the pain of this, because there's just no way she's going to make it at this stage. And then, of course, when the doctors come in and they tell you the odds and they tell you if she was born, that there's a high chance she'll have some cognitive delays. And so you're just like, okay, all right, this is not going to go well. And so that's the mindset that I went into it with. I felt bad for putting her through all of this. I felt bad that my body was supposed to be what protects my baby. Newborns aren't supposed to be doing anything other than sitting around and sleeping all day. And here she is having to contend for a different battle for her life almost every day. It's hard. And you will feel very difficult things. I guess the prevailing thought was just don't attach. Don't love her. Don't fall in love. Don't feel that. But then I heard her cry, and that was it. It was too late. I was in love. I knew it was going to just destroy me if something happened to her. But it's over at that point. You have to kind of be in it because the attachment's there. The bond is formed. You just want her to make it. And however that looked like, if she did have cognitive delays, and she still might, if she needed supports, like whatever she required. It was what we were going to do at that point once she actually was in this world. So it's a lot of emotions. That's a long way of getting around to saying that it's just a roller coaster. So it's, just prepare to strap in. What's so wild is that when you become pregnant, the first thought is, okay, what's my birth plan going to be? How many people do I want in the room? What kind of music do I want played? Like you go into, I guess, the specifics of what happens when everything is perfect. It just didn't occur to me to think about what would happen if that plan changed drastically. Like if I want to go in drug-free and they offer me an epidural, I'm going to say no. But then if something happens where I might need to get rushed to an emergency C-section, okay, then I'll take the epidural. We'll go with what needs to happen. So you go in with a certain degree of flexibility with your plan, but when you go into labor preterm, it just it's gone. Your plan is over. Suffice it to say, everything that you are hoping for and wanting for your birth, you have to be okay with letting it go. You have so many people who have to be in the room to help you with your birth, but also to make sure that your baby survives. So I think another thing that I was really not expecting was just the amount of drugs I had to take. Because again, my plan personally, and it's totally fine if this wasn't your plan, but my plan was I wanted to go in drug-free, no epidural, no nothing. The minute they were like, okay, we have to give you this magnesium shot so that, basically her circulatory system can come online. Absolutely, go for it, do it. Take the steroid shots, whatever they want to give you, you kind of have to go for it because it's what's going to help her to survive. It's funny because my husband, Chris, was the one who really, I guess, championed me getting some help. When I went and they did determine that, okay, this is really going to go down today. I, of course, called him immediately. He dropped everything, took our 4-year-old to his brother's house and came to the hospital. After a while, they're like, okay, you're having these contractions, but we're giving you medication to slow them down. The ideal situation is that you'll calm down the laboring now and we'll be able to transfer you to a higher level hospital. So in his mind, he's like, oh, okay, we're going to be here for a while. So I'm going to go home and get some clothes and make sure we kind of get the bag ready that we did not get ready at all because it was so early. We didn't have the grab bag on hand. So he left and went home to pack things up and my contractions just kept coming. And so I was like, you have to get back here right now. So he got a cab, got back as soon as he could. And luckily he made it in time to watch her be born. He got there and he was kind of sitting back and, he was holding my hand and we were both just kind of crying and going through everything together, which was nice. Once she was born, they had to put her in like a plastic bag. So you have like a little saran wrap baby. He actually got to cut the cord and, we got to have some photos taken, which was amazing. I couldn't have done it without him. So I had to go into theater for some additional surgery to have my extra placenta removed. And in doing so, that made it where I could not travel with my daughter once she needed to be transferred for a higher level of care. They whisked her away in the ambulance and I had to wait a few hours. And then I was very, very grateful for the hospital. They actually helped us to get a taxi down. So it was a 4-hour drive to get to her, but I was able to get there that night. So that was a bit stressful, just having to be apart from her, to not be able to ride with her. So I imagine if you have a C-section or if you've had general anesthesia or are for whatever reason unable to travel with your baby, that can be really scary. But the teams that take these kids are amazing. I'd say it does take a little time just to understand what the unit's schedule is, what their processes are. I'd say after maybe the first week, you'll really start to get a hang of what is happening at your particular NICU. So with us, for instance, at the level 3 hospital where we were, they actually do parent-led ward rounds. So we were able to actually have a day each week where we would tell the doctors what was going on with her and have a good understanding of what medication she was on and what symptoms she was presenting with that week and whatnot. So it was really nice to have that level of involvement. But when we went down to level 2, they really didn't have that because a lot of families that come in don't stay as long as you need to when you're just at a level or when you're at a level 3. So those are some minute differences, but for the most part, you're going to have ward rounds every day where the a consultant, kind of like the highest level of specialist doctor, will come and assess your baby. Then you'll have cares throughout the day where the nurse or nursing team that is watching your child will help you to start to do yourself. So that's changing the diaper, having some special sterile water to clean her mouth and clean her nose, and of course feeding. Typically we'll start with tube feeds, and then moving into maybe bottle feeds or even breastfeeding if that's something you want to do. But for the most part, it's just falling in line with the schedule, just like you would with any kind of new situation. I cannot speak more highly of the teams involved with my daughter's care. It wasn't just the medical side of things. They absolutely were professional and on top of everything that needed to happen with her intubation and with, of course, when they needed to do cannulas or blood work or any of that, scans. The absolute care that each and every person shows for not only your baby, but for you. It's amazing. I felt very supported at every turn. I felt like I was around people who, and they'll say, "Oh, it's my job." It's so much more than that. Like, it's so beautiful how they just look at everything so holistically. I felt so educated. I felt like the fact that they usher you into an understanding of what's happening with her medically, while maintaining such care for you as a person and as a mother, or a birthing person. It's absolutely amazing. It can be kind of daunting to know that, okay, at some point, I will have to be her primary carer for 24 hours a day. At some point, I won't have this monitor here to tell me that she's breathing. So it can be scary, the prospect of going home. But I will say that there was still a plan in place to have ongoing supports once we left the actual facility. So we were never alone. We're still not alone. She's 6 months old and we still have a health visitor that comes in, an occupational therapist that comes in, a physiotherapist, speech and language person. So there's not at any point a cutoff, So not only are you ready at the hospital to finally go home, but I'd say you get to a point where you're ready to be like, okay, all right, I got this. We can do this. She came home on oxygen. She came home with an apnea monitor. She came home with an outreach team still coming in twice a week to make sure she was all right. I still have those moments where I just look at her for a while and, okay, she's breathing. I'd say that's more the normalcy of being a parent. If you're feeling uncertain about what you're feeling, whether it's some kind of pain or just a cramp or something's just not right, just pick up the phone. Call your midwife, call your local hospital or your local maternity unit. Just have that question answered. I hate to inconvenience anybody. It's really hard for me to bother people. The people that you're going to go bother, they want to be bothered. They love this stuff. This is what they went to school to do. This is what they got their degrees and certifications in. This is what they chose to do with their lives, is to be there for you in this moment. So take advantage of that. What I would say is just you have to look ahead. Have that future vision of, okay, 5 years from now, uh, it's going to be fine. And you'll start to migrate your mentality around your identity being a premature baby's mother or premature baby's parent or guardian. Sometimes things hurt so badly because you love them so much. So, if anything, try to think of your grief or sadness or the moments where you're not as happy or positive or optimistic. Try to think of those moments as just the evidence of how much you cared and how much you loved. She'll never not feel loved and cared for, because we went through all the kind of bad things, if you will, to get to a point where we can finally experience the good. So we're very happy that she's here and doing really well.